The Supreme Court's going to decide whether we're going to get it or not, and we never know how they act, even with some of the fine people that are on that. But the reality is this, is that I want to share something with you. If you haven't learned, liberals don't learn from their mistakes. They're like Italian race car drivers. What's behind them doesn't matter. If it failed once, they'll just try it again and give it a different name. Think about it. They call themselves progressives now. They did that in 1920. Then they went to socialist. Then they went to liberal. And they've screwed those names up. Now they just come back to progressive again. And that's what we get. And the reality is that when we look about Obamacare is, wouldn't it be nice if we asked a doctor how to take care of our medical condition, both in the industry and with the people? And this next person, we only have 2 more speakers left. This next person knows something about medicine. He's a doctor. And you would think that Obama would have asked real doctors instead of a bunch of actors in white coats. Ladies and gentlemen, please welcome Dr. Joe Tarta.
Good afternoon. I was asked to speak about what I think is kind of a dry subject, but since I'm not in practice anymore and I'm not running for political office, I could, I think, bring some of the issues that we're dealing with as far as Obamacare affecting physicians personally, but it's hard to separate physicians personally from you and me as regular individuals because it's really overpowering us all. We're now facing in medicine the management of the medical practice by the government. And it's not new, it's just getting a lot more intrusive. It's affecting our physician population as far as practicing because they're leaving in unprecedented numbers. The first year ever recorded this last year with more physicians leaving private practice and working for hospitals as salaried employees than in private practice. That's never happened in America before. We are anticipating, and it's been published by the American Association of Physicians and Surgeons, that they're estimating we'll have a shortage of 160,000 MDs by the year 2025. The Association of Medical Colleges has found that physicians are being driven from practice, and mostly it's because of the overregulation, partly because of decreased funding by the government of physicians in practice. Medicare basically rules the majority of physicians. Medicaid, the insurance companies are basically now controlled all by something that the AMA has come up with, and I'm going to go into that shortly, a coding system which allows or it mandates that every office visit from every patient is coded. The coding goes to the government as well as to the insurance companies. And what happened this January 1st of this year, 2012, a new program went into effect called the Health Information Technology. It's commonly referred to as e-prescribing. Every time a physician prescribes a medication for you, it gets coded. All the doctors now have to comply with this, or they're penalized by a decrease in reimbursement from the government or from the insurance companies. I think it's 2% annually. The software packages for this thing is something between $40,000 and $80,000 per physician practice. But more interesting is what happens with the information. When a prescription is written, that information is sent to these government locations, but more so than that, everything on your charts, your weight, whether you smoke, you have a gun in your house, your social history, your family history, all your personal information, everything's coded now. So this information is transmitted, and it basically ends up at a local health decision market, which in 2013, 2014 will come into play and be the end-all decision on whether or not you get that surgical procedure, stent, aneurysm procedure, if you're taken into the emergency room, they will theoretically approve or not approve your office or hospital visit. How that's going to work is yet to be determined, as is most of Obamacare, because we're not given the details of it yet. Nancy Pelosi's line about if you want to know what's in it, read it, makes sense, but it's 2,500 pages. I want to talk a little bit about the AMA and how the AMA has affected all of this with us, because the AMA does not represent the physicians. 15% of the physicians are involved with the AMA only, and in the last 2 years, 2010 and 11, 12,000 of them left annually. The AMA, though, has a good reason for being in existence. They have profited from this program called the CPT Management Company. This is the coding system that all medical issues have to be coded when they're sent in, and the AMA copyrighted the coding system. So the AMA owns it. Annually, the AMA changes it, so every year the physicians have to buy the software package current for their specialty. The estimate is that the CPT system is worth $72 million now. So the AMA, while not representing you or I or the physician community, is basically a very strong political party affiliate and supports Obamacare because of it. The shortage of physicians is estimated to get worse, but what they're doing is this last year, when statistics were formulated, they found out that more physicians leaving private practice, going to hospitals, becoming employees of the hospitals, and working as salaried employees or retiring early. The solution they've found to this is to train the new young medical students in socialized medicine. That's where they're headed, because that's an approved management of what we'll be dealing with down the road. The medical panels that are forecasted to be in charge of our care, coming in 2 years at the farthest, are going to be omnipotent. It won't matter whether or not you have private insurance. If you're Medicare age and have Medicare and also have private health insurance, or if you're under Medicare age and have private health insurance, it's not going to help you when it comes time for anything to be done that's, whether it's elective or whether it's necessary, it still will have to have the panel's approval. So while this is going to the Supreme Court, and the Supreme Court may make a decision on it, a lot of this is not new in medicine. A lot of this has been coming slowly. The CPT system by the AMA has been there for 10 years at least. I used to have someone in the office that was just responsible for keeping up with the CPT changes in just my field. And the AMA solved it by just annually submitting a new package to our offices for X thousands of dollars. They basically have us under sort of it's like a snowball rolling downhill. If the Supreme Court stops it, I think more will come. I don't think it's over. This is going to take a protracted fight. I could probably go on. There's no point. I think the message is clear, and I'm here to support all of our candidates because of it. Thank you.
GrokTV.